3 persons from the metro, 1 from Kamrup rural and 7 in South Assam have tested positive, taking the number of COVID-19 cases to 56. 3,471 new confirmed cases of novel coronavirus reported in the country in 24 hours. Union Health Ministry issues additional guidelines for quarantine of returnees from abroad. Arrival of the first batch of stranded people, students and individuals of Meghalaya from various parts of the northeast starts. And IIM Umsoli in Meghalaya converted into a Corona Care Centre, largest in the state and probably also in the region. Good evening and welcome to the Northeast News. This is Jushna Borua with the news in detail. Assam's capital city Guwahati has been put on Corona alert. 3 persons from the metro and 1 from Kamrup rural have tested positive, taking the number of COVID-19 positive cases in the state to 56. In a press conference today, Health Minister Himanta Biswa Sharma expressed his concern as 3 out of the 4 tested positive have no travel history and there may be more undetected infected persons in the city. On the other hand, Guwahati Medical College Hospital has been restricted for general patients for the next 3 days as one of the PG students of the college was identified as COVID-19 positive yesterday. He also informed that about 386 persons of the hospital were quarantined immediately after the detection of the doctor's case. In a recent development, 3 more positive cases have surfaced in Kachar, taking the total number of active cases to 8 in the South Assam district.
তাতে বহুদিন থকাৰ পিছত 2 মে তাৰিখে তেওঁলোকে আজমিৰ শৰীফৰ পৰা আহিছিল আৰু শিলচৰত 6 তাৰিখ
A sudden spurt in the number of COVID-19 infections in Assam has created fear psychosis among the people of the state. Our reporter Kamal Bora has the details.
Scenario in the state has become alarming as 8 new cases were reported yesterday and today also 3 cases have been reported from Silchar. All these cases are COVID-19 positive and which has led to the total number of positive cases rose to 56, and it's a huge matter of concern because if we talk about Guwahati city, 1 doctor has been identified as COVID-19 positive case and due to which the medical hospital has been restricted for common patients. And it's a huge matter of concern. And if we talk about B. Bora Cancer Hospital, that is also declared as a containment zone because 1 16-year-old girl has died inside the campus of that hospital due to this COVID-19, and that is why most of the people are worried where they will go right now for any treatment, whether it is cancer, whether it is other common disease, where they will go at this moment. And that is why it's a huge matter of concern, and definitely we will hope that in the days to come, state government will sort out this issue also. And apart from that, since Dr. Himanta Biswa Sharma, the health minister, has addressed a press conference in view of the present scenario of COVID-19, he has said that 4 cases were identified in Guwahati city also, out of which 3 cases has no travel history. That's why he has expressed doubt that there may be more cases who have not been detected so far, and it's a huge matter of concern. They may lead to community spread. That is why he has urged each and every citizen of the city that nobody should come out of their home if there is no emergency, and everybody should obey the lockdown norms. Nobody should violate the lockdown norms at this moment since the situation is very much critical. This is Kamal Bora from Guwahati for DDO Home.
A total of 3,471 new confirmed cases of novel coronavirus have been reported in the country during the last 24 hours, taking the total number of cases to 56,516. Health and Family Welfare Ministry said that 16,867 patients have been cured so far and the recovery rate reached to 29.35%. During the last 24 hours, 108 deaths have been reported, taking the nationwide toll to 1,895. In the global scenario, the total COVID-19 cases have touched a staggering figure of 39,37,099. A total of 96,487 cases were recorded in the last 24 hours, while a total of 13,51,292 cases have recovered. The death toll, however, has reached 2,72,970. Meanwhile, USA has recorded 29,655 new cases in the last 24 hours and Italy 1,401 cases. The Ministry of Ayush presents the Ayush Sanjeevani mobile app for understanding the measures adopted by public for enhancing immunity and keeping themselves healthy in this crisis of COVID-19. The app is designed as a simple but effective mechanism of electronic documentation for studying population behavior. Response of the public to the advisories issued by the Ayush Ministry on immunity enhancement will be an important area of examination. The ministry has a target sample size of 1 million people for the study, making it one of the largest in any discipline of medicine. Post the Vande Bharat mission to bring in all the stranded Indians from across the globe, the Union Health Ministry has issued additional guidelines for quarantine of returnees from abroad, contacts and isolation of suspects or confirmed cases in private facilities like hotels, service apartments and lodges. With large number of hotels, service apartments and lodges unoccupied due to impact of COVID-19, many people who do not have requisite space at home may opt for such facilities. This is likely to reduce the pressure on the family, give comfort to the person and protect the family members and immediate neighborhood. These facilities will offer single room on paid basis with attached washrooms, and the tariff for the accommodation and services will be fixed by the facility in consultation with the state government.
अनिवार्य इंस्टीट्यूशनल क्वारंटाइन में रहेंगे। गंतव्य पर पहुंचकर सभी की मेडिकल जांच की जाएगी और सभी को आरोग्य सेतु ऐप पर अपने आप को रजिस्टर करना होगा। अगर कोई यात्री सिम्प्टोमेटिक पाया जाता है, उन्हें हेल्थ प्रोटोकॉल के अनुसार मेडिकल फैसिलिटी में पहुंचाया जाएगा। बाकी यात्री इंस्टीट्यूशनल क्वारंटाइन में पहुंचाए जाएंगे। 14 दिन के
Addressing the media today, ADGP CID Assam L.R. Bishnoi said that 10,050 bottles of cough syrup containing the chemical iodine phosphate, which is one among the banned substances to be used in the list of 237, were seized on 7th of May. A total of 9,500 bottles from Guwahati and 550 bottles from Nagaon were seized. Total 5 persons have been arrested in this connection. The bottles were transported from a godown named Nitco in Lokra area in Guwahati. The consignment was allegedly being transported to Bangladesh and is assumed to be estimated at an approximate amount of 10 lakhs. In a significant development in Tripura, 24 new BSF personnel from another BSF battalion deployed at Ambassa under Dhalai district were found COVID-19 positive on Thursday. With these new 24 patients, the COVID-19 positive figure in Tripura now stands at 88. With 2 patients discharged after treatment, presently COVID-19 active cases under treatment in Tripura is 86. In another press conference, State Additional Chief Secretary Health S.K. Rakesh said that there was no positive COVID-19 case found among the students who returned from Kota and other states. More than 200 students have already been tested and all reports were negative.
Which includes both BSF personnel.
The movement of the first batch of stranded people, students and individuals of Meghalaya from various parts of the northeast has started. 76 persons in Ratachera, 557 in Bornihat, 277 in Bajangdoba and 45 persons in Tikrikila were screened. On arrival, they were registered and sent to their respective destinations through transportation arranged by the government. All of them will have to undergo home quarantine along with their family members for 14 days. In Shillong, 3 buses reached Jawaharlal Nehru Stadium at Polo Ground, which is designated dropping point, carrying 38 passengers. The Manipur Chief Secretary stated that the government is committed to bring people back safely to their homes. Stranded persons who would like to come by special trains will have to register themselves in the official website www.tengbang.in to facilitate organizing of trains and working out the logistics. The first train to ferry stranded passengers from Bangalore may start from Saturday or Sunday with a total of 1,200 people. Even though the state of Manipur is declared green zone, keeping in view the gradual rise of COVID-19 cases in some northeastern states and people returning to the state cabinet had decided to impose the lockdown with limited relaxations and necessary orders were issued. In a decision taken in the cabinet meeting held with Chief Minister N. Biren Singh in Imphal, the cabinet approved that the passengers' fare for bringing back stranded persons to Manipur by train will be borne by the government. The cabinet also decided that the cost for other modes of travel will be met by passengers themselves. The state government will issue necessary passes for facilitating their movement in this regard. Those stranded persons returning to the state who are neither COVID suspects nor COVID contacts and asymptomatic shall be kept under home quarantine as per protocol. However, if community objects to home quarantine for any such returnee, such person will be accommodated in community quarantine. Meghalaya Chief Minister Conrad K. Sangma inaugurated the state's largest Corona Care Centre in IIM Umsoli on the 7th of May. Speaking after the inauguration, Sangma said that IIM Umsoli, which has been converted into a Corona Care Centre, is the largest in the state and probably also in the region. The entire process of setting up the centre was done within a month's time with help rendered from different departments of the state government. He also informed that the centre is equipped with a staff of 70 people and that the 3-floored centre with 258 beds is totally segregated for staff, suspected cases and patients. After yesterday's tragic mishap in Vizag, Union Home Ministry has denied media reports that there was another gas leak in Visakhapatnam. Official spokesperson clarified that this was a municipal technical leak and it was required to bring the container in control. The spokesperson further said that the minor leak has been controlled and the process of neutralization is already on. The situation is now under control. Teams of NDRF and NEERI are on ground to support the local administration. To end the news, the main points once again. Three persons from the metro, one from Kamrup rural and 7 in South Assam have tested positive, taking the number of COVID-19 cases to 56. 3,471 new confirmed cases of novel coronavirus reported in the country in 24 hours. Union Health Ministry issues additional guidelines for quarantine of returnees from abroad. Arrival of the first batch of stranded people, students and individuals of Meghalaya from various parts of the northeast starts. And IIM Umsoli in Meghalaya converted into a Corona Care Centre, largest in the state. And that's all in this bulletin. Thanks for watching. Namaskar.